Cardiovascular pathology, pericarditis. All right, so pericarditis is going to be split up into two. We're going to have acute pericarditis and constrictive pericarditis, which is also known as chronic, okay? But acute pericarditis is the first thing that we're going to start off with. And hopefully this is going to be a really quick, helpful way to kind of differentiate everything. So first off, what is pericarditis? It's just the inflammation of the pericardium, right? Very easy. It's what surrounds the heart, and it can cause that constriction of the heart, okay? It can present similar to our cardiac tamponade, but remember, this is different. Tamponade has fluid within the pericardial space. This is just the pericardium getting inflamed, okay? Now, what does it present like? The patient is going to have sharp pain aggravated by inspiration. And if you see the patient sitting up and leaning forward, then that is like kind of a sign that they have acute pericarditis, because it's relieved when you sit up and lean forward, because it kind of takes the pericardium off the heart. Okay, so you no longer have that rubbing. The patient is going to present with a friction rub. If you see a friction rub, boom, start thinking about it. Okay, and the EKG changes are going to show a wide spread. Okay, so all of the leads are going to show a ST segment elevation. Very odd, but if you see diffuse ST segment elevation, then start thinking about acute pericarditis, okay? Now, a form of acute pericarditis is fibrous pericarditis, okay? It has a triphasic scratching sound with the diffuse ST elevation, okay? Very similar to acute pericarditis. Essentially, it's a type of acute pericarditis. It's fibrous pericarditis, okay? But it just has a triphasic scratchy sound, and it's just, that's the only difference, okay? And don't forget that friction rub for the acute pericarditis, okay? Now, what can cause acute pericarditis? Autoimmune diseases are rare, but what we need to focus in on is SLE, okay? So the most common heart issue associated with lupus, SLE, is acute pericarditis. So keep that in mind as you're moving forward. Lastly, a viral infection is the number one cause of all acute pericarditis, okay? So overall, understand what acute pericarditis is, and hopefully I can help compare and contrast it with constrictive pericarditis. But just a quick overview, acute pericarditis, you have the friction rub with the diffuse ST segment elevation. If you have fibrous pericarditis, you're going to have that triphasic scratchy sound. And SLE is highly associated with acute pericarditis, as well as viral infections. Okay, cool. Moving forward to constrictive pericarditis. I'm going to simplify it very easy for you guys, okay? So what you need to know about constrictive pericarditis is four things, the four C's. Constrictive is one of the C's, so perfect. Another C is chronic, okay? So it's chronic inflammation of the pericardium. Very easy. Another C, which isn't a C, it's a K, is the pericardial knock. Okay, so we actually have a pericardial knock heard rather than a friction rub, so friction rub for acute pericarditis, pericardial knock for constrictive pericarditis. And lastly, we have another K, but I say C as well, is the Kussmaul signs, okay? And we're going to discuss the Kussmaul sign and what it is right now. So the Kussmaul sign, which is seen in constrictive pericarditis, is the paradoxical increase in the JVP on inspiration. So what does that mean to us? Remember, as I said, as we inspire, as we take air in, okay, we cause blood flow back into the heart increases, okay? So we take a lot more blood from our venous system and we drain it right into the right atrium as we inspire. But patients that have constrictive pericarditis or chronic pericarditis, they have the Kussmaul sign, where if I inspire, I don't see the return of the blood into the heart. I actually have an increase in JVP, because normally it should decrease when I inspire. But now with constrictive pericarditis, because I'm blocking the heart, it can't relax. So I can't fully get the blood in there. So I'm going to see an increase in JVP, a rise in jugular venous pressure upon inspiration. Okay? Very important to know that. Lastly, something that they like to ask about is that you're going to see a rapid Y descent on the JVP graph when looking at a constrictive pericarditis patient. Okay? And all that means is that when we have constrictive pericarditis, there's going to be a rapid descent on the JVP graph. So just take a look at that. Make sure you understand that. But the four C's is what helps me. I know it's kind of stupid because only two of them are C's, but constrictive, chronic, knock, and Kussmaul. Most important things that you have to know about constrictive pericarditis. For acute pericarditis, you got friction rub, widespread diffuse ST elevation, with fibrous pericarditis having a triphasic scratchy sound and its association with viral infections as well as SLE lupus.